of the menstrual function, please. And first read, please, Tunya.
It's a 27-year-old woman complains of having disorders of menstrual function for 3 months, irregular pains in abdomen. On bimanual examination in the dextral appendage range of uterus, there is an elastic spherical formation, painless and 7 centimeter in diameter. In ultrasound, a fluid formation 4 centimeter in diameter, unilateral smooth. What kind of treatment is most preferable? It's a prescription of estrogen gestagen complex. I think this is polycystic ovarian syndrome.
My dear, but how we set the diagnosis? What happened to this woman? What is the diagnosis here?
It's polycystic ovarian syndrome, right?
No, my dears, it is not polycystic ovary syndrome. Dextral appendages. Polycystic ovarian syndrome, it is bilateral process, usually, yes. Elastic formation, very large, 7 centimeters. Polycystic ovarian, do you remember how it looks like ovaries? A lot of small cysts near the margin of the capsula, yes, during ultrasound investigation. Here, during ultrasound, see, yes, we have the ovary, inside ovary fluid, and 4 centimeters in diameter, it is cyst, not small cyst. Yes, it cannot be. It is functional cyst, which appear, do you remember I told you that we have the decrease of estrogens and progesterone? There is no forces in this follicle to be ruptured. Follicle rupture according to the increase of the level of progesterone. Maybe this woman has progesterone insufficiency and has persistent ovarian cyst which cannot rupture. Yes, it can be on the first menstrual cycle, second, due to the slightest hormonal disorders. Usually, if it is cyst, we remove that cyst, but this cyst only 4 centimeters. Then young woman, you see, 27 years old, yes, it's not regular, this stage for her. We name this functional cyst. This cyst can disappear spontaneously after the next menstruation, but maybe stay. That's why we suggested monitoring of this woman prolonged the 3 months and indication of what? What does it mean, estrogen, gestagen drugs? It is replacement hormonal therapy. This woman has insufficiency because the follicle cannot rupture in the middle of the menstrual cycle. Yes, we have the decrease of the hormonal level. And that's why we prescribe this replacement hormonal therapy with estrogen and gestagen, such as progesterone, as if you remember, yes. And then we repeated examination. If there is no effect of our treatment prolonged 3 months, we suggested woman this operative treatment. But first of all, prescribe the hormonal treatment, and only after this suggested our complex. Here, a functional cyst due to insufficiency of hormones, guys. Understand?
Yes.
The next, please read the next. I don't know how to. The next, please, Aulak Navjot Singh.
A 14-year-old girl complains of profuse bloody discharge from genital tract during 10 days after suppression of menses for 1.5 months. Similar bleeding recur since 12 years on the background of disordered menstrual cycle. On rectal examination, no pathology of internal genitalia. In blood, HB is 70 and RBC is 2.3 into 10 raised power per liter, and that HT is 20. What is the most probable diagnosis? Juvenile bleeding and post-hemorrhagic anemia.
What are the signs of juvenile bleeding in test and anemia? Can you tell me?
It's anemia, so there is HB is very low and RB erythrocytes also low. And for juvenile bleeding, the age is 14, and
Yeah.
that
And anemia 70, yes. Polycystic ovarian syndrome cannot be Verligov. It is blood disease. No hormone productive ovary tumor, no any sign, and to non-complete abortion, no any sign of pregnancy. Yes. Так, guys, the next, так, Kaushal Shanil absent today. Yes. Absent. Number 4. Khan, please read the test. Oh, number 3.
Girl, age 13, consulted the school doctor on account of moderate bleeding discharge from the genital tracts, which appeared 2 days ago. Secondary sexual characters are double, which is the most probable cause of the bloody discharge. Menarche, the first menstruation cycle.
Menarche, you are quite right. Yes. Thank you. Number 4. Number 4, please, Mandip Singh, read.
A 20-year-old patient complains of amenorrhea, objectively hirsutism, obesity with the fat tissue prevailing on the face, neck, upper part of body. On the face, there are acute vulgaris. On the skin, striacutis distance. Physiological and intellectual development is normal. Gynecology condition, external genitals are moderately hairy. Acute vaginal and uterine hypoplasia. What diagnosis is the most? It's Cushing syndrome, teacher.
Guys, remember about this. It is objectively
Because there is
hirsutism, obesity, fat tissue on the face. Yes. Then no any disorders of intellectual development and external genitals, usually hyperplasia. Yes, Ikhtsenko-Cushing syndrome. Remember about it. Stein-Leventhal, no signs. Turner, no. Shehan, also no. And Babinski-Franklin, also no. But remember, maybe present in KROK. Ikhtsenko-Cushing. The next, number 5. Так, number 5, and read for me. Milimva present, yes? Or absent? On the first hour he was here, but now I don't. Milimva, are you here? I'll put him absent. Please, Mahanti, Ashit, read the test. Yes, that's why it is premenstrual syndrome. Also, every year present this test. Thank you. The next, euthymia, please read.
A 24-year-old patient, 13 months after the first labor, consulted a doctor about amenorrhea. Pregnancy has concluded by cesarean section concerning to a premature detachment of normally post-placenta hemorrhage, has made low fidelity 2000 mil, owing to breakdown of coagulability of blood. Choose the suitable investigation. This is determination of the level of gonadotropins.
It is what diagnosis?
This should be I don't know if it's Sheehan's or polycystic.
It is Sheehan syndrome, the crisis of pituitary, and that's why estimation of sexual hormones of the ovaries, estimation of gonadotropin levels. I see that Milimba appear. Please read the test number 7. Milimba.
Yes, teacher.
Number 7 test, read please.
Okay, so a 29-year-old patient underwent surgical treatment because of the benign serous epithelial tumor of an ovary. The post-operative period has elapsed without complications. What is the necessary prescribed? What is it necessary to prescribe for the rehabilitating period? Okay, so the hormonotherapy and the enzyme, the proteolytic enzyme.
Hormonotherapy, because we decrease hormonal function to 50%, we remove the tumor of the ovary, yes, and proteolytic enzymes to remove and to make the prophylaxis over the adhesions, yes. Thank you. Number 8. Number 8. Nidhi, please read the test.
A 28-year-old patient complained about prolongation of intermenstrual periods up to 2 months, hirsutism. Gynecological examination revealed that the ovaries were enlarged, painless, compact. Uterus had no peculiarities. Pelvic ultrasound revealed that the ovaries were 4 to 5 centimeter in diameter and had multiple enlarged follicles on periphery. X-ray of skull base showed that the cellular region was dilated. What is the most probable diagnosis? It's PCOD.
Yes. Stein-Leventhal. What are the signs here in the test?
There is hirsutism and the
Yes.
X-ray shows, no, the ovaries are enlarged and follicles are present on periphery.
Yes. No, if you have reached that ovaries increase in size and on periphery follicles, of course it is polycystic PCR, Stein-Leventhal or sclerocystotic ovaries. Thank you. What? Rentgenography by showed the region was dilated. It's maybe possible if we speak about the Stein-Leventhal syndrome. Let's know here what does it mean dilation. This means dilated. Yes, is you think about the pituitary tumor, yeah? No, you need to look for, it cannot be pituitary. I don't know why they give you. Sometimes maybe Sella-Turcia dilation, if we speak about the polycystic ovarian syndrome, but it is not specific. Here, we pay attention, first of all, to specific signs. It is the ovaries, hirsutism, and delay of menstruation. The next, number 9. Так, Salim Yamin, yeah?
Yes. Woman consulted a therapist about fatigability, significant weight loss, and weakness, loss of appetite. She has been having amenorrhea for 8 months. A year ago, she born a full-term child. Hemorrhage during labor made up to 2 liters. She got blood and blood substitute transfusion, so it's the most probable diagnosis. So this is Sheehan syndrome. She had postpartum bleeding, heavy bleeding.
Yes. Postpartum bleeding, and we have necrosis of the pituitary gland.
Yes.
Number 10, Swain, please read. Pretty, are you here? Pretty absent or something wrong with computer?
Yes, teacher.
Can you read number 10?
Yes, a 30-year-old patient complains about inability to become pregnant over 3 years of married life. The patient is supernutrition type. She has hair along the median abdominal line, on the internal thigh surface, and in the peripapillary area. Menses started at the age of 16. They are infrequent and non-profuse. Ultrasound revealed that the uterus was of normal size. Ovaries were 4 into 5 into 5 centimeter large. Had a lot of cystic inclusion. So what is the diagnosis? This is polycystic ovary because ultrasound reveals that uterus, in ovary there are many follicles, lot of follicles, cystic follicles.
Yes, pay attention. Menarche may be late. At 16 was her
Yes.
menarche. Yes, supernutrition. Do you remember I told you obesity? And of course, there is no what pregnancies at all. Yes, they can give you different, but usually you recognize in most of cases, as experience shows, students recognize this polycystic ovarian syndrome or Stein-Leventhal. Guys, and the last one, it is Suresh. Please read the test number 11.
In the woman of 24 years, about earlier normal menstrual function, cycles become irregular according to tests of function diagnostics and evaluatory. The contents of prolactin in blood is boosted. Choose the most suitable investigation. Computer tomography of the head.
Why we indicated this method of investigation, first of all?
Maybe there is some problem with the pituitary.
Yes, because what we have, increase the level of prolactin. In order to exclude pituitary tumor, first of all, we computer tomography indicated. But guys, I want to say at the same time, we estimated the level of gonadotropins in this woman. We perform ultrasound usually, and no, progesterone usually, first of all, hormone, but if you have increase of the prolactin, usually, first of all, computer tomography, because the first reason it is the tumor of pituitary gland, yes, and then you indicated other methods of diagnostic, but these methods also present if we speak about the pituitary tumor, but you need to approve this diagnosis or need to remove this diagnosis. That's why, first of all, computer tomography of the head. Yes, guys, for today enough, and for tomorrow it is benign tumors of female genital organs. We continue, or maybe we can continue to speak about KROK test if you have a wish, guys.
Yes, teacher. Let's do it. Yes, let's do it.
Let's continue, yes?
Yes.
Yes, no, let's continue. So, no, we begin at the very beginning again. Hunya, read the test number 12. Guys, and tomorrow we'll begin at 10 because we have another meeting in the department. At 10 o'clock, I wait you guys. Now read, please, Hunya, the test number 12.
A 25-year-old woman applied to a maternity welfare clinic and complained about being unable to conceive within 3 years of regular sexual life. Examination revealed weight gain, male pattern of hair distribution on the pubis, excessive pilosis of thighs, ovaries were dense and enlarged, basal temperature was monophase. What is the most probable diagnosis? Sclerocystosis of ovaries.
Yes. Another name of this disease? Guys.
Polycystic ovarian syndrome, yes.
Polycystic ovarian syndrome or Stein-Leventhal syndrome. Yes. What are the signs here?
This patient has infertility, increased weight, male pattern of hair distribution,
and what?
scoliosis
Dense
and
ovarians, yes.
yeah.
No, all signs of polycystic ovarian syndrome. But I told you about it. You see, we have read 3 tests where we have polycystic, where we have sclerocystosis, where we have Stein-Leventhal, which is the same disease. Yes. Number 13 and plus Navjot Singh, read.
26-year-old woman complained about edematous swelling and painfulness of mammary glands, headache, tearfulness, irritability. These signs turn up 5 days before menstruation and disappear after it starts. What clinical syndrome is? Premenstrual syndrome.
Yes, of course. Young woman, it cannot be post-castration. If it will be operation, they describe, it is post-castration. But here, young woman, which at the same time, before menstruation, appear these symptoms. You're quite right. Number 14, please. Number 14. Так, Kaushal again absent. Yes, that's why Khan, please read.
13 months after the first labor, or 24-year-old patient complained of amenorrhea. Pregnancy ended in cesarean section because of the premature detachment of normally positioned placenta, which result in blood loss at a rate of 2000 ml owing to disturbance of blood clotting. Choose the most suitable investigation. Estimation of gonadotropin rate.
Yes, and what syndrome we have here?
Amenorrhea.
No.
Like,
amenorrhea we have. It is one of...
We check for the pregnancy here, like...
My dear, you miss everything to my mind. It was pregnancy. During cesarean section, woman lost 200 milliliters of blood.
Okay. Yeah, okay, Sishan syndrome.
Shehan, yeah. Shehan syndrome, yes. Так, the next one, 15. Mandeep Singh, please.
A 30-year-old patient consulted a doctor about menstruation absence for 2 years after labor, loss of hair, body weight loss. The labor was complicated by hemorrhage caused by uterus hypotonia. Objectively, the patient is asthenic, extranogenital or hypoplastic. The uterus body is small and painless. The appendage are not palpable. What is the most likely diagnosis? Sian syndromes.
Syndrome, yes. Hypotonia of the uterus, hemorrhage, yes, after labor, and amenorrhea, absent of menstruation. Of course, it is Shehan syndrome. It was Mandeep Singh, yes?
Yeah.
The next, Milima, please read the test number 16.
Okay, so a 49-year-old woman complains about headache, head and neck going hot, increased perspiration, palpitations, arterial pressure rise up to 170 over 100, irritability, insomnia, tearfulness, memory impairment, rare and scarce menses. Body weight increased by 5 kg over the last half year. What is the most likely diagnosis? So it's like, it's climacteric syndrome. It's the syndrome that begins before the menstrual, the
Yes,
menopausal,
yes.
menopausal.
To what we guys pay attention? First of all, every time in gynecology, very significant for us, it is the age of the woman. Yes, it is near the 50. Usually think about any disorders hormonal. Yes, climacteric syndrome. If it is 49 years old woman, yes, that's why. And palpitation, increase of arterial pressure, hot flashes. Yes, she has headache. All this the signs, weight gain, all this the signs of climacteric syndrome. Premenstrual, it's usually they describe young. Dystonia, no here any signs. Yes, dystonia may be prolonged all life, but these symptoms in this woman appear only when he become older. Yes, hypertension, no, they not accompanied with hot flashes, for example. Weight gain, then post-castration syndrome. Here, no any signs and no any word about operation. That's why, of course, it is climacteric syndrome. The next, number 17, guys. So, guys, we have 10 minutes. Read very quickly and solve the test very quickly. Natalia, please, Eutemia, read the test. Natalia, Eutemia, please read the test. Eutemia.
Yes, ma'am. A 25-year-old patient complains about having amenorrhea for 3 years. She associates it with difficult labor complicated by massive hemorrhage. She also complains of loss of weight, hair fragility, and lack of appetite and depression. Objective examination reveals no pathological changes of uterus and its appendages. What is the disease pathogenesis? This is a hyperproduction of gonadotropin.
Yes, guys, it is what disease this woman has?
She hands.
Shihan. You're quite right, guys. But you see 3 variants of answers. They ask you what method of examination, investigation of gonadotropin level. They ask you about the diagnosis, Shihan syndrome, and now they ask you about the pathogenesis, hypoproduction of gonadotropin. That's why be very attentive when you solve this test. Maybe different interpretations. Yes. The next one, number 18. Thank you, Temia. Nidhi, please read.
A 29-year-old patient complains of absent menstruation for a year, milk discharge from the nipples when pressed, loss of lateral visual fields, X-ray shows an expansion of cilia. What is the most likely cause of this condition? It's pituitary tumor because there is prolactin hyperproduction, milk, and there is X-ray shows the expansion of cilia, which is pituitary expansion.
Guys, especially if the woman have disorders of the vision, loss of lateral visual fields, it is the specific pituitary tumor, yes, and hyperprolactin, it is milk from the nipples, yes, you're quite right. And we have any changes of cellular, it is pituitary tumor. Maybe sometimes they ask
loss
you.
Loss of lateral visual fields is not
loss of lateral visual fields.
It's due to because of the pressing on the optic chiasma, right?
Of course, but the pressing of the tumor, yes.
If the tumor is not so much enlarged,
yes,
this complication wouldn't be seen. So it is not specific to the pituitary
but
tumor.
usually, if we speak about the KROK syndrome, yes, and tumor, they gives you this loss of lateral visual fields, usually present in KROK test. Do you understand me? Number 19. Так, Salim Yamin, please read the text.
Yes. 27-year-old patient complains of irritability, tearfulness, depression, and sometimes aggressiveness, headache, nausea, vomiting, swelling of the mammary glands. The mentioned problems arise 5 to 6 days before the menstruation and gradually progress until menstruation 3 days after the problem disappears. What is the most likely diagnosis? Premenstrual syndrome.
You're quite
right. No,
here no any regular appear and before menstruation.
Yeah.
No. Так, number 20, please, Pretty, read the test. Pretty, are you here?
Yes, teacher.
Read, please.
A 30-year-old female patient complains of milk discharge from the mammary gland, 5-month absence of menstruation. She had one physiological labor 4 years ago. Objectively, mammary glands are normally developed. Bimanual examination reveals that the uterus is decreased in size. The ovaries are of normal size. MRI scans shows no cerebral pathologies. Concentration of thyroid stimulating hormone is normal. Serum prolactin level is increased. What is the most likely diagnosis? So hyperprolactinemia, because here it is written that prolactin is increased.
Yes, guys, but what they suggested you, it's maybe due pituitary adenoma, yes, but what they don't said you about the disorders of vision, and first of all, what is the significant in this test? It is MRI scan shows no cerebral pathologies. That's why you choose hyperprolactinemia, but not pituitary tumor, yes? And the last one, please read, Suresh.
A 28-year-old patient complains of infertility. The patient has been married for 4 years, has regular sex life, and does not use contraceptives, but has never got pregnant. Examination revealed a normal state of the genitals, tubal patency, basal body temperature recorded over the course of 3 consecutive menstrual cycles appear to have a single phase. What is the most likely cause of the infertility? It's the anovulatory menstruation cycle.
Yes. Why? It is anovulatory menstrual cycle.
Because the menstrual cycle is in single phase. It has been appeared in
Yes, single phase, but more better say not single phase. Maybe you can meet in KROK monophase. Yes, it is the same monophase. Yes, menstrual cycle monophase. There is absent increase of the temperature in the middle. Yes, and usually it is the signs of anovulation, guys. No, and if we have a time, we have 3 minutes. This question prolong the last 3 years to my mind repeated. This 28 years old patient complains of profuse, painful, and prolonged menstruation before and after menstrual period, spotting, lasting for 6 days. Vaginal examination revealed that uterus enlarged and corresponding to 5 weeks of pregnancy. Limited mobility and painful. Appendages are not palpable. On the 5th day of the menstrual cycle, uterus was of normal size. On account of status problems in objective examination, patient has been diagnosed with internal endometriosis. I remind you, it is test from it is adenomyosis of the uterus. Which drug should be used for effective treatment? Dufaston drug contain progesterone and structure of this progesterone is very near to the nature structure of progesterone. And this is dufaston. Remember about it because this test is repeated every year, dufaston, if we speak about the internal endometriosis or adenomyosis. Guys, for today enough, yes, and we will meet tomorrow at